This is Dr. Evan Kangong of Dr. Kangong TV, where medical science meets real life. Vasomotor symptoms, which we refer to it as VMS, from some of my patients about how would it affect their health. So I just came to talk a little bit about it today. So first of all, vasomotor symptom can be very distressing. Just imagine you're sitting in the middle of a meeting and you just start having this, also known as hot flashes, just this swoosh air that just, like the heat that just comes and just overtakes you. Just imagine, first of all, you'll be so uncomfortable that you would not be able to focus. You would just not feel right. And just imagine, sometimes sweat might start coming down your face, sometimes even your hands. You might see that, and it will be so difficult for you to focus. So that's why it's so important to do all what we can to be able to prevent that. It's really hard to prevent when you're in menopause, or to reduce the frequency of the symptoms. So really, really important. So how can vasomotor symptoms affect your health? First of all, I've talked about how it can be embarrassing. It can affect your functioning during the day. It can decrease your sleep quality. It can make you irritable. Like when you're not yourself, or you sit somewhere and you just feel like your clothes are all wet. It can make you just feel uncomfortable. It might even make some women lose their self-esteem because they're like, oh my God, everybody's watching me, right? It can also make you decrease your concentration because you can't function when you're feeling that way. It can also affect your quality of life. Like if you cannot sleep well because you keep having all this night sweats and all of that, it can affect your quality of life, right? And it can lead to poorer health status overall. Because if you don't sleep well, you can't function well. You wake up the next day, you're exhausted, you go to work, and then you have another hot flush. It's almost like you're just living from one hot flush to another. So really, really important for it to be addressed so that you can live a better health, better life. And so there have been some studies that have shown that some like people with more frequent vasomotor symptoms have less favorable cardiovascular health markers. This can increase your risk for heart disease, or which we also call coronary heart disease. Okay, moving on. Sorry, I'm just having my tea and lemon. So the studies shows that menopausal hormone therapy, which is also known as MHT, or in the past they used to call it hormonal therapy. You can either use the systemic estrogen, you can use the patch, the gel, and the oral tablets. If you don't have any contraindication to the oral tablet, it really helps reduce those symptoms, together with progestogen or progesterone, which also for those with a uterus. Remember, if you have a uterus, you have to use the Prometrium, or sorry, that's the brand name. You have to use the progestogen to decrease the risk of the lining of your uterus.